Right about now, I'm ready to launch her to you. She's a pretty woman, and very importantly for the discussion today, she is a medical doctor, first of all. She is also the Commissioner for Health in Cross River State. I'm sure the name is already beginning to ring bell. Is Dr. Betta. Thanks for coming on.
Thank you for having me.
I also know you're the national chairman, the Nigerian Health Commissioners Forum.
Yeah.
All right. That's a whole lot. And let me start from the first time I saw you talking about COVID-19. That's way back. It looks like years now. It was only last year.
Last year.
And I was like, wow, she's doing good. There's no COVID in Cross River. Calabar is safe and all that and all that. Do I relocate and all that? And then suddenly the first was recorded. And I felt really sad for you. What went wrong?
Okay, so I think the first things first was that we accepted the fact that COVID was real, even before Nigerians understood that COVID was real and it could come to Nigeria, it could come to Africa. So as early as January, we started a lot of preventive measures. I'm sure if you can recall, Cross River State started the no mask, no movement, even ahead of WHO's recommendation, ahead of the federal government PTF approvals. We started the no mask, no movement. We manufactured over 1.5 million face masks and distributed around the states to people, individuals, free of charge. Our state was the first state that actually shut down, isolated the states basically. So we closed all our borders, we shut out. We didn't shut the state down, but we shut all the borders, both international and interstate borders, long before the federal government gave the go-ahead for these borders to be closed. So a lot of preventive measures were taken as a state government on time, right? But of course, when we approached June, July, when the federal government said that the interstate lockdown was over and they must open up the roads and the airways and everything, of course, all of that was obeyed. These places were opened, and then you had influx of persons into the state. Definitely, once you have the travels, you must see the cases, because people who are infected introduces it to those who are not infected. It's just like the prisons, the correctional center in Cross River State. The correctional centers were shut down from like March to about July. So people were not going into the correctional centers. Those who were there were left there. Nobody was introduced there. And so you would never hear about a case of outbreak there, right? But at the point where we said, okay, you can open up, we created an isolation center for them. And then, of course, a sample collection point at the correctional center. We now had new people come in, and amongst those new people, there were some that were positive. But if they were not isolated and they were taken directly into the general cell, you would definitely have a breakout of COVID-19. So that's the scenario that played out in Cross River State. Really, of course, at some point where there's free movement, you definitely would have cases.
You know, even though you have recorded numbers, I think it's about less than 200, yes. So I know before December, you were hovering less than 100.
Yeah.
And then suddenly there's a spike. Yes. And I was thinking maybe with everything going on, even though you stopped the Calabar Carnival happening, you may have been able to shoot up with the festive period. But you have managed to stay at the bottom. You know, I still want to know, beyond the example you just gave us on the correctional centers, what other things are you doing as a Commissioner for Health to ensure that the spread does not move as much as...
So first, the spread really, there are several ways in which it happens, right? You look at the community spread, which is usually the big factor right now. Persons to persons, people who don't believe in the virus, people who take those protocols for granted and the rest of it. So you identify who do they listen to? In Cross River State, we had to identify the Christian Association of Nigeria. In fact, they are part of the COVID-19 response team. They have their own task force that goes from one church to the other to ensure that the right things are being done. And it's the same for the Islamic religious group. So basically, you identify those who those community people listen to, because sometimes they might not be listening to you as government. Whether you like it or not, they just believe, oh, you're government, we're here, down here, so it's all politics. But when you speak to the people they listen to, and you have pastors stand on stage to tell them, look, COVID-19 is real and you need to protect yourself. And of course, we're not saying God doesn't heal, God doesn't protect from COVID and all of that. But here's the point. The Bible says that you should respect constituted authorities. So if constituted authorities say that for public health reasons, everybody should use a mask in public places, when they go to church, when they are engaging in all of their businesses and the rest of it, you should be able to respect that. When constituted authorities say use half of your capacity such that people can be able to sit at 2 meters apart from each other, you should also be able to respect that. At least the Bible says so, and the Quran also says the same thing. So basically, we've been working with the religious leaders, we've been working with the traditional rulers. These are high influencers, and they can be able to speak to community members and get them to do what is right. And then, of course, trying to make these things free and available to them. Most people, you might think, oh, how much does a face mask cost? It's just 200 naira probably, or 500 naira, isn't it? And then you want to say, what's 500 naira as compared to your life? But really, if you go to communities where things are very hard for them, they don't understand it that way, right? And so they tell you, I don't have 200 naira to buy a mask. So if government tries to bring in that form of equity and provide these things for those who are less privileged or underserved, it would help in compliance. So Cross River State has been targeting some of these things, and that helped us really keep our numbers under.
You know, one of the newspapers today, talked about scarcity of water as being part of the problem.
Sure.
How are you tackling this within the communities, the rural communities especially?
So I think it was just an issue of will I say opportunity meeting preparedness or something. So for Cross River, a lot of things were done right, and then the pandemic met those things. For instance, when Governor Betta came on board, he created the garment factory. And then, of course, the pandemic happened, and the garment factory was there to produce this face masks in their numbers and then give out to the public, having NAFDAC certification and the others, and then it was distributed to the public. It's the same thing for the water. In the last 2 years, looking back, the governor committed, I think, $15 million to rural water supply, and he brought these drilling machines that go from one community to the other, drilling and providing water for them. Of course, it's not all encompassing. There are still areas where you have gaps existing in Cross River State, but most communities benefited from it. And then, of course, the water board, which provided water for the major urban centers, was also revamped. So they started providing water to the community. So the pandemic just came and met something that was already ongoing, that was already happening. So the effect was not that much there, but there's still communities that do not have access to water and all of that. And what the paper says is very correct. If we say people should wash their hands often to be able to avoid coronavirus and several other diseases, then we must be able to improve on the WASH program and provide these hand washing facilities. Even as schools go back, how many schools, especially in rural areas, have water to wash their hands? Have we provided alternatives like the Veronica buckets that they can use, fetch water, put into it, and then have students wash their hands as they come into school, after break time, before they leave at noon and all of that? If those things are not provided, then we might see these numbers continue to rise.
Okay, one of the arguments for some people, not just in your state, they say that we are not testing testing, enough? We will be getting to have you answer that question, not just for Cross River, but in Nigeria totally. But we intend to take a break, get to find out, still from NTA Calabar, are we testing enough? Why do we have numbers going up and down? But maybe before the break, you could answer that question. Are we doing enough testing?
No. So Nigeria is not testing enough. And for every one case you see, there are probably 7 that has been missed. Nigeria is not testing enough. And to be very honest, like I was discussing at the PTF, there are basic things that as a country we need to invest in as a matter of urgency. These are not negotiable. Right now in Nigeria, every single state should have a public health molecular lab that can test not just for COVID, but for every other thing in between. TB, yellow fever, name it, every other thing in between. We should have standard molecular lab built in the 36 states of the Federation and in the FCT. It's not negotiable. In fact, in some very big states like Lagos and Kano and some of the big states, you should have 2 or even 3 of those standardized molecular labs. And that's why we're calling on PTF and the federal government to immediately intervene. I was so happy when I heard that they're going to be building the oxygen plants in all the states. These are basic things that you cannot negotiate at this point. In Nigeria right now, there are states that have to depend on private labs to be able to function. There are states that have to depend on private institutions. There are states that have to send samples to Abuja. You find those samples, they can stay in Abuja for 2 weeks, 3 weeks before the results comes back. There's a lot of backlog left, right, and center. It's because we do not have standard molecular labs built in all the states of the Federation. And I want to plead with the federal government. This should not be left for the state governments to decide whether they can do it or not. Different state governments have different financial capacity and might not be able to invest in building a standardized molecular lab. If we have that, then we have the right incentives to test. Right now there's a rule that says we're trying to launch a campaign working with the PTF to say that each local government should test 450 samples in 2 weeks from each local government. We have about 700 plus local governments in Nigeria. If you times that by 450 samples in 2 weeks, you can imagine the amount of samples you will have at our hands. We do not have the laboratory capacity to be able to manage this. So
I know that as of today we have tested just a little above 100,000 people, but that's from you. We will be going, as I promised earlier, to Calabar, NTA Calabar, to get to answer this question again. From the eye of the journalist, are we testing enough?
The novel coronavirus is tested and conducted in commercial, private, and academic laboratories. This test involves inserting a 6-inch long swab, like a long Q-tip, into the cavity between the nose and the mouth for about 15 seconds and rotating it several times.
Okay, and the second in the mouth.
Oh my God, the nose? That's painful. No?
For 3 seconds, I finished. Don't move, please. Okay, that's finished. You are finished? Yes.
That's very uncomfortable. The question is, how many people have availed themselves to test for the virus?
I haven't tested for COVID before. I've not gone for it, and I'm very sure because I have a very strong immune. So there's no how I can be affected with COVID-19.
I just had it too, but I've never tested. If they say move around to test, I would like to test.
If peradventure I'm asked to undergo the test, I think it's a welcome development so that we know our status.
What are the excuses and the underlying factors?
We are not testing enough, and it's very terrible because we are talking about a second wave. And the reasons we are not testing enough are many. Our facilities have suffered what is now well known by everybody when the testing facility was destroyed by the hijacked NSAS demonstration last year.
There's a possibility that we might have more cases of COVID, yes, in Cross River State, because we are not testing. And that's why we are really appealing to the federal government. If we want to have this disease under control, we must strengthen states to see how their testing sites are well equipped, and of course every state that doesn't have should be supported to have one.
As scary as it may seem, it is pertinent to test for COVID-19 and also adhere strictly to the rules of safety against the novel coronavirus pandemic.
All right, the interview is still on. My guest is still in the house, and I've seen quite some messages coming in. We'll take them, one by one. But there's a fire share says the problem we have with the increase is that government puts law and do not have enforcement. And speaking what he said, some people have actually opined that we should have COVID-19 marshals. Do you think in the entire country it will be a welcome idea? Because I'm speaking because I have gone to certain places with my face mask. I go to a shopping mall. Before I bring out my ATM card to pay, I sanitize my finger, and the people are looking at me as if I'm an idiot. You go to the open market. I want to buy my vegetable. I try to protect my hands. If I don't have a hand sanitizer, I try to wear the mask, the hand gloves to take it. After which I try to sanitize. My face is all covered up, and sometimes they even call me Antikoro. I don't know. What are you bringing into the market? Do you think we actually need some form of enforcement, just like Toyoshi said?
They have to be enforcement. You see, this is the thing about government, right? We have a lot of policies. The issue is with implementation. They have to be enforcement, and I don't think it needs to be centralized. I think it needs to be on a state-by-state basis. So we should have a task force. Like in Cross River State, we have a task force, and we have vehicles, over 50 vehicles that were purchased by the state government, have been put into the task force. They are strategic places. They show up at people's events. They try to get people to adhere to the protocol. It's important that this task force exists, because really, people don't listen. People, even at their own detriment, even when their lives are at risk, they don't listen. You watch your TV every day and you see big parties going on. Parties that have over 1,000 persons, and you see people dancing, having fun. Meanwhile, they know that we have a pandemic that we're dealing with, and it's not just parties, every other thing in between. So government at the state level now, even at the local government level, should create task force and then get them to go around and ensure that the right things are done. Shut down bars, shut down nightclubs, and all those places that are high risk spreading events and the rest of it. Try as much as possible to see how you put people in check. It's really very sad that you go to public places and you find people not using their face masks. It's very, very sad. Sometimes even in Abuja, where I am right now, right, you find persons who are just busy going about their business without face masks. Then the cabs is the same thing. You go back to your states, you go to some areas, and you find people not adhering to these protocols, to what you're supposed to be doing. So really, they are, before we find the almighty vaccine come in, they are non-pharmaceutical vaccines that we should be taking right now, which is your face mask, hand sanitizer, and all the protective measures to protect yourself. And governments at state and local government level must create task force to enforce it.
A lot of times we have talked and heard so much said about how to use the face mask. And I also know that as much as it's very good, it's like money. They say it's necessary evil.
Yeah.
Face mask can also be a necessary, evil and vent for it to get into your system. Would you mind to explain this to the public? I mean, the way we use it, some people use the medical mask and we don't wash it. Is that the right thing to do?
Okay, so there are
discard it.
the different forms, right? The one which is produced at the Cross River State Garment Factory and in several other places, which is the cloth mask, right? If it's produced according to specification, it's good and it would protect you, right? After each use, wash with warm water and then of course dry it out and then iron it and then you use it again, isn't it? That's for that one. When you have the surgical masks or the N95, these are not reusable. So after using them, you need to discard them and then get a new one to use. So when you have people who use them forever, it's actually wrong. The point where you take it off and drop it on the surface, you don't know if the surface you're putting it on is actually contaminated. And then you pick it back from that surface and you put it on your face and you're giving yourself a direct infection.
I've seen a lady put it in her makeup bag.
Which is wrong. Okay. Which is wrong too. Right? Because you are not sure that those surfaces are free. They could have come in contact with someone else who might be having the virus. And then another thing is the way we use the mask. So this is really very common in my state, right? Because you find a lot of people carrying the masks, wearing the masks and all that. But you see people wear it under their nose. Or some of them just hang it under the chin, or they just put the earpiece on. I don't get it, right? You see them just keep it. Some will just hang it on one ear and then it's dangling and just hanging off there. And if the task force come at them, they'll say, "Oh, I'm here with the face mask." But you're with the face mask, or you're going to an event with a face mask, and your nose and your mouth is not being covered. It's as good as not wearing it in the first place.
Exactly. All right, a lot of people are writing in, asking questions and making contributions. Let's see. COVID-19 is indeed real. Since the spread of this pandemic can be curtailed by strict compliance to non-pharmaceutical protocols, let the media and well-meaning citizens continue to educate the populace. We should, as a people, step up our humanitarian activities. One Love Nigeria, James Maigari, FCT. Thank you so much for that, James. We'll continue to do our bits. Unical will be resuming on Monday. Can Betty Edu tell us the provision they have made for students in Calabar in terms of COVID-19? Dr. Francis Effa.
Okay, so that's a good one. First and foremost, the University of Calabar has created a COVID-19 task force that is headed by Dr. Akiba, which is also a consultant, a medical doctor, right? And this team is supposed to work with the COVID-19 response team in the state. We have been in several meetings already, and the preparation is on the way to ensure that people are protected as they come back to school. But really, the understanding has to be very clear. Like I told them, we've issued all the protocols to them, we've shared a lot of documents with them, but the understanding has to be very clear. Individual students that are coming back must take responsibility. The school is going to provide the hand washing facilities all around. The school is going to provide hand sanitizers. The school will provide some basic things which are needed. But individual students must take responsibility to ensure that at every point in time, their face mask is properly worn. They have their hand sanitizers that they use from time to time. And of course, the spacing within class, so you don't go hugging your classmates, assembling together and doing all those activities that could increase the risk of spread of the disease. So we're working with them. The task force has already been formed, and we want to advise every single university or school in Nigeria, as the schools are opening on the 18th of January, please create your own school local task force. COVID-19 task force that would ensure strict adherence to the COVID-19 protocols.
All right, as I said, your life is in your hands. It's you that will make good use of it, and truly well. We may conclude that government itself isn't directly encouraging people to flout the rules regarding COVID-19. The international airports through which COVID-19 came to the country are still open. How then do they expect people to agree to close schools, nightclubs, and religious centers? That's coming from Ibn Malik in Kano. Okay, let's see if we take one more before we go. Both government and public must exhibit a trusted synergy and create seriousness in all health challenges to remove prejudice, falsehood associated to COVID-19. That's Matthew, Union State, where you're writing in from. Okay, it says schools to open on the 18th January is a welcome development, but all hands must be on deck to ensure that protocols are observed. That's from Norom from Umokabia in Abia State. Thank you so much. We'll continue with this later on, but I must say thank you for coming in.
You're welcome.
Almost at a very short notice you showed up. I appreciate that, and continue to spread. I want to hear finally that there is no more anywhere. No more.
Grace Nigeria.
I want to hear you speak the way you spoke last year, April.
Sure.
Let it happen for not just Cross River State, but for Nigeria.
Sure.
Because we must all,
work together. Yeah.
All right. We've been talking with the national chairman, Nigerian Health Commissioners Forum, and also the Commissioner Health, Cross River State, in the person of Dr. Betta.